Hi everyone. Today we'll talk about an interesting experiment conducted by the Salt Substitution and Stroke Study with the results published in the New England Journal of Medicine. If you are curious about how a small change in diet can reduce the risk of stroke and serious cardiovascular events, then stay a while and hear about the finding. The Salt Substitute and Stroke Study involved over 20,000 participants from 600 rural villages in China. The study found that using a salt substitute with 75% sodium and 25% potassium by mass led to lower rates of stroke, major cardiovascular events, and death from any cause when compared to regular salt. The participants in the study were aged 60 or older and had high blood pressure or a history of stroke. The villages were randomly assigned to either the intervention group, which used the salt substitute, or the control group, which continued to use regular salt. According to the study, using a salt substitute resulted in a 14% decrease in the incidence of stroke compared to regular salt. Additionally, there was a 13% reduction in major cardiovascular events and a 12% decrease in mortality rates. Concerns about hyperkalemia or high levels of potassium in the blood associated with salt substitutes have discouraged the use of these products in the past. However, the study found that the rate of serious adverse events attributed to hyperkalemia was not significantly higher with the salt substitute than with regular salt. Elevated dietary sodium consumption and low levels of dietary potassium intake are associated with high blood pressure and an increased risk of cardiovascular disease and premature death. A previous study found that if a potassium-enriched alternative replaces salt widely across China, it could potentially prevent 365,000 strokes, 460,000 premature deaths, and 1,200,000 vascular incidents annually. Salt substitutes are available in many countries worldwide and have proven blood pressure-lowering effects in diverse populations. If you're concerned about your blood pressure and cardiovascular health, talk to your healthcare provider about incorporating a salt substitute with reduced sodium levels and increased potassium levels into your diet. The Salt Substitution and Stroke Study provides evidence that this simple change may make a big difference in your long-term health outcomes. That's all for today's episode. Don't forget to like and subscribe, and we'll see you next time.